Hello, everyone. Welcome to Mom's Corner. Happy New Year. I hope everyone's doing well today. My name is Zainab, your host. I'm sorry again that you can't see me, but hopefully you can hear me okay. I want to thank everyone for joining us again today. And I hope and pray that this will be a great year for all of us, filled with good health and love and peace and safety. Before we proceed, I would like to remind everyone that, as promised, we will issue stipends for those who are here today. I will share the link to the stipend form shortly via the chat box. And for those who are regulars on Mom's Corner, thank you for being here. And for those who are joining us for the first time, welcome and thank you. A big thank you to our amazing group of doctors today for being here. Mom's Corner is one of the many programs under the umbrella of Global Perinatal Services, or GPS. And GPS is a nonprofit organization doing amazing work and changing lives every day. Our mission is to provide community-based doula services that will educate, respect, and empower low-income, Black, refugee, and immigrant women and their families during pregnancy, birth, and into early parenting. And Mom's Corner is a space not just for moms, but for all women folk, because at GPS we believe that motherhood is an extension of a woman's identity and not the definition. And Mom's Corner, since the pandemic, has become not just a space where we come together to find empathy, support, and camaraderie, but a safe haven and access to so many critical resources in our communities. And our today's topic is winter illnesses and keeping your kiddos out of the ER, an important topic for everyone, especially if you're a caregiver or parents. And so because the winter season seems to be that time of year where all the illnesses kind of rear their ugly heads. So hopefully we can address some of those today, especially with the triple demic of the RSV virus and the flu and the COVID. And so I will hand it over to our doctors, but if you have any questions, please feel free to drop them in the chat box or raise your hand if that's okay with our doctors, and they'll go ahead and let you ask your question or comments as well. Without further ado, doctors, the floor is yours.
Thank you so much for that introduction and centering us on sort of what brings us all together today. We appreciate that so much. I think we need to figure out how to share our screens still. And I think this is always the hardest part for us.
Let me make you a co-host. Would you like, you are
who's going to be going?
Yeah, I can share my screen if you want to make me co-host. In the meantime, maybe we can introduce ourselves while we're figuring that part out. Thanks so much for having us. Go ahead, Kime.
My name's Kime McClintock. I'm one of the resident doctors at Swedish First Hill Family Medicine. I use she, her pronouns, and I have been here before on some prior months, but it's been a few, so it's great to be back and good to see everyone.
I'm Claire Miller. I'm also a resident at Swedish First Hill Family Medicine and excited to be back. Thanks for coming, everyone.
And can everyone see the title page now?
I can.
Hi, everyone. I'm Joanna Posada. I'm also one of the family medicine residents at the Swedish First Hill program. And I'm excited to be here on this rainy evening. Let me just make sure, Kime, you're starting, right? I just want to make sure that I can, oh yeah, there we go. Great. I wanted to make sure that the advancing was working.
Thanks so much. So yes, welcome everyone. Like we said, winter illnesses, definitely a big topic this year, and how to keep kids out of the ER. So some of the things we'll go through today are just the status of winter illnesses in Seattle and sort of broadly across the country, what we've been seeing in terms of numbers and trends, both this year as well as sort of historically when peak seasons are, how to prevent severe illnesses, symptoms and supportive care, and then of course warning signs and making sure we're clear about when would be important times to go to the ER and when it's safe to stay at home. And then questions, and please feel free to drop questions as we go into the chat or raise your hand or unmute yourself. And we want this to be interactive and make sure we're covering up everyone's questions as we go. And then of course, there'll be time at the end. So to begin, just to start us off with a question, and feel free to unmute yourself or put it in the chat. Rough estimate, how many colds or viral illnesses do we think is typical for kids? And we could say like infants, toddlers, preschool age, and school age kids. How many illnesses is common for 1 year or within normal? We've got someone in the chat saying 15. I like that guess. 20.
Wow.
Oh my goodness.
Fortunately, it's
It's a little 25. Oh my gosh.
wow.
So between these are great guesses, and I think there is like a pretty broad range, but between 6 and 8 is very common. And then of course, anytime kids are in being exposed to additional people, they're getting exposed to more viral illnesses and viruses. So kids that are in daycare or in school or have siblings that are in daycare or school are definitely going to have increased exposure, and then as such probably increased numbers of colds per year. And so up to 12 is very much within the normal limits for babies, toddlers, and preschoolers. But I think that probably 15 is not abnormal. 20 or 25 is maybe a little bit high, but yeah. I don't know. I would say all that just goes to say that I think a lot of times parents are really worried that my kid was just sick earlier this month and now they're sick again. And it doesn't necessarily mean that anything is wrong with that kiddo. It just means that they're getting exposed to lots of viruses and likely their body's fighting it. And it's building up some of their immune system. And then this slide is just a historical look at flu season trends. So at the bottom, we see October through May, which is sort of the typical flu season. And then looking back from 1982 until this, I guess not the one we're currently in, but the year before, looking at which months had the peak number of viral flu infections. And so February, we're coming up to, has historically been sort of the highest month, but this December through March range is pretty typical. And then there's a note on the slide just pointing out that the 2020 to 2021 season isn't captured in this data just because there was no true peak that season, in part because so many folks were at home or masked up during the beginning of the COVID pandemic.
And I'll say too, I think just like on the note of what we're talking about with like the number that is quote unquote normal of illnesses for kiddos to have, I think at least anecdotally this year, we are seeing so many more, I think, than in previous years. And part of that is because of like a lack of immunity that kiddos have built up, like this year in particular, because they've spent the last 1 to 2, almost 3 years kind of in isolation because of COVID. And so that lack of exposure to a lot of these viral illnesses has then meant that their immune systems aren't as prepared to fight them off. And so if you're noticing that your kid is sick like all the time this year, that's partially why, because their immune systems haven't really gotten the exposure that ordinarily would let them fight stuff off. Claire, go for it.
This slide, sorry, it's kind of a bad graph, but I just wanted to point out that it sounds like you guys already know from the awesome introduction that we got, but there are tons of different viruses that cause kiddos to be sick. And now even more than ever, any one of those viruses can cause kids to be really sick. We know that, in the past, it was usually flu. And then this year we saw tons of RSV. We were seeing lots of COVID in the last 2 years, but that's died down a little bit. So you can see that so this is data on respiratory illnesses in Washington this year, and it kind of drops off at the end of December or around Christmas. We don't have data after that, but you can see that there's this huge peak about, in November and October, about a month or two before the holidays. And flu is at the top, but there's also a lot of RSV, and then rhinovirus, which is another like common cold causing virus, was in orange there. Yeah. So this is a table. It's kind of fun. It talks about the differences and symptoms you might have between the cold, the flu, COVID, and allergies. This is actually kind of like, I guess they've redone this chart. It's like a classic historical chart. And I feel like you should take it with a grain of salt now, especially like it used to be that the common cold was caused by things like COVID and rhinovirus. And now you can kind of get like really sick with any of these. So just because you don't have a fever doesn't mean that your kid can't get really sick. And we'll talk a little bit more about like warning signs later. But I think kind of the most consistent thing is like when kiddos get body aches and a fever, that is like more frequently associated with the flu rather than just a simple cold. And then again, COVID can really cause any of these things. I think I know it says that like stomach issues and headaches are rare, but this is kind of just like a general trend. It can be really helpful for knowing what's like allergies, maybe like an asthma exacerbation, because in that you wouldn't have a fever. You probably wouldn't have like body aches. It's more like upper respiratory symptoms.
Cool. So kind of just like some basics about the flu. I know we kind of just had this chart up there, kind of comparing like the triple-demic viruses along with the common cold, but does anyone want to kind of shout out or put in the chat some of the like common symptoms that they would expect to see if them or their kiddo had the flu? And Kime and Claire, if you can read stuff in the chat for me, that'd be great.
High fever.
High fever, yeah, for sure.
We've got runny nose and cough in the comments as well.
Cool. Yeah, so the flu is caused by, there's several different viruses that cause the flu. The two most common ones in the United States are the influenza A and B viruses. And again, like Dr. Miller was mentioning, like the symptoms range and be different for all these viruses. But for the flu, what you're most commonly going to see, cough for sure, kind of like all of them. Fatigue and weakness is one of the most common symptoms of the flu. Like you'll kind of hear people say like, oh man, I feel like I got hit by a truck. Like people are just really like knocked out on the couch with the flu. Your kiddo might look super, super tired. Fever for sure, more so with the flu than with just like the common cold or even with RSV. Although of course, COVID can also cause fever, chills, and then headache is kind of seen as like a more sort of like flagship symptom of the flu as compared with COVID. Of course, like Dr. Miller was saying, like, yes, runny nose, like, yes, sore throat potentially, but those might be a little bit less common with the flu. Symptoms of the flu will last for usually about a week. But with all of these viruses, because cough is such a common symptom from all of them, one thing that I kind of want to emphasize is that it's really common for the cough phase to last beyond 1 week for any of these things. So the like real sickness of like the fever, especially, and the headache and the fatigue might last for like 3 to 7 days. But kiddos and adults can have coughs that linger from viral illnesses for a couple of weeks, like up to 2 to 3, sometimes even longer. And that's not necessarily a sign that there's something wrong. That can be normal.
I think there's a good question in the chat that I think
cool.
is a good place to go from there. Danielle asked, how long should folks stay away when they're sick or from others that are well?
Do you want me to answer that? Yeah, I think a good rule of thumb, and it's really tricky. It's different for all of these viruses. A good rule of thumb for any virus is like, if you are still having fevers, then you are definitely still infectious. And so like definitely use that as like a guiding point. I know some schools will like let your kid come back to school, like if they've been 24 hours without a fever, which is like reasonable. And also one of the reasons that kids continually get sick from school, because you can be contagious with the flu for like 8 to 10 days. RSV, you can be contagious with for a little bit longer than that. It actually tends to have a pretty long contagion period. And you can also be contagious, you know, in the 2 to 3 days before you even know you have it, like before you get symptoms, you can be contagious with RSV. So like definitely my kind of guidance with COVID aside, because that's a little different, but like when you're febrile, definitely stay away from people. And if you want to be like extra safe, like if you know you're going to be around people who are older or immunocompromised, and you got a diagnosis of the flu or RSV, I would say even if you're not febrile, but like probably isolate or like be cautious and washing your hands and maybe wearing a mask around people for like 7 to 10 days. Anything else you guys want to add to that or other questions about that? I'll talk about it a little bit more on the next COVID slide, because
I
that's
think that was a really good sort of rule of thumb answer. And especially your point at the end that it kind of also depends on what who you're going to be around, like little kids, older folks, or immunocompromised folks, especially.
pregnant.
And then just the one thing that I think has really struck me as a takeaway from the last few years of the COVID pandemic is just that we have seen how well masks work in terms of limiting how much infection you're spreading. And so if you are sort of feeling much better, but worried you might still be contagious, then it's never a bad idea to just wear a mask and play it safe.
Totally. Oh, there's my information about the cough can last for longer. Anyone want to shout out like, you know, symptoms that they like think are sort of unique to COVID, or like things that can distinguish COVID from some of the other viruses that we're talking about? And again, if you guys can let me know what's in the chat, that'd be great.
Yeah, I believe Demaria had a question in the chat. Yes.
I can read it out loud. This is a great question. Do you have any suggestions on how to be proactive in preventing children from getting sick? So to piggyback off that, how do I prevent my preschooler from getting my newborn sick? I'm breastfeeding, but are there particular things that I can add to my diet? I think that's a really great question, and I'll start off an answer and feel free to my colleagues to weigh in. But I think, yeah, it's common that families have kids, one of whom is maybe a newborn and one is, you know, in daycare or in school, and maybe a couple are in daycare and school, or maybe older kids. And so bringing a lot of different things home, because you don't, just because you have a newborn at home, it's not realistic for most families to be able to just keep everyone at home. So I think the things that to make sure your family is proactive about doing is, if you're particularly worried about your newborn, or if you're in that like first month of life when we're like extra cautious with newborns, making sure that the people who are around them are vaccinated, up to date on their vaccinations, are washing their hands before touching your newborn. Or if they have any certain exposure, if their work requires them to be in a place where they're interacting with a lot of people from the public, asking them to wear a mask. And some of this, the guidance is a little bit like families have a different sense of risk. And so I think some families are not as worried about making sure everyone around their newborn is up to date on vaccines. I think as medical professionals, we are risk adverse. And so we give pretty strong guidance, and then you have to find what fits for your family. So washing your hands, masking when able, and asking guests or family members who are coming into the home from having different exposure outside the home to mask if they can, and hand washing. I can't stress hand washing enough.
Totally. That's cool. That yeah, we'll talk a little bit about prevention later, but I didn't know about elderberry, which you guys are putting in the chat, like sea moss and elderberry as a way to prevent that. That's very cool. I was gonna like add another kind of maybe more medicalized perspective, but just you mentioned that you're breastfeeding, and one of the things that we know is that like passive immunity from breast milk is also being transmitted from the infant, so to the infant rather. So if you are getting like your COVID booster and your COVID vaccine, antibodies against COVID are also being passed along to your baby through breast milk. So that's considered one way to kind of give your newborn some extra protection. And that's also one of the reasons that we're not really talking about whooping cough too much during this talk, because it's not like one of the classic winter viruses that we're seeing right now. But That's one of the reasons that we recommend giving the Tdap vaccine during pregnancy around 32 weeks, both to the person who's pregnant, but also to anybody in the house who is going to be around the baby, because whooping cough can be like pretty debilitating and pretty bad for kiddos. And so we want to make sure that people who are going to be around the kiddos are vaccinated against whooping cough and also, you know, the flu and COVID. But yeah, would love to hear just sort of anecdotally other things that you guys have found helpful in terms of like dietary things that you've found helpful for immunity.
Yeah. Hey everyone, this is Faisa. Thank you everyone for being here. Hi. Yeah, I think we have a bunch of doulas in the house as well. So often, you know, our clientele, you know, some of them do vaccinate, some of them have, you know, the vaccines already for themselves and for the kids, but also it's dietary is something that we discuss a lot with, because we do see people from various different parts of the world. And, you know, so yeah, I'm really glad to hear that some of the things that are being suggested in the chat. So vitamin D, vitamin C, echinacea, you know, ginger and turmeric as like go-to for most of our people. And these are, you know, as you all know, these are traditionally, these are things that people used and still using, you know what I mean, around the world to fight, or it's more of a building the person's immune rather than, you know what I mean. So yeah, it's really awesome to see people dropping some of these natural things as well. And elderberry is one of those things that people pretty swear on it, and it's pretty effective. Yeah, so awesome. Keep on coming, y'all.
Black seed oil, cool. Yeah, so we've been talking about COVID. These are some of the other, you know, symptoms that are common with that. Loss of taste and smell, obviously, is one of the things that people have really been noticing a lot with COVID. And the isolation period with COVID is a little bit different than other viruses, just because there's like more specific guidelines from the CDC about it. And yeah, I see there's other stuff coming in the chat, and I just can't see it while I'm sharing my screen as well. But yeah, so COVID symptoms can last for a really long time. And I guess we're not really talking too much about like long COVID tonight, but that is, while like the acute illness from COVID often for people lasts like somewhere between like 3 and 10 to 14 days, people are definitely noticing longer symptoms from COVID too, in terms of like cough and fatigue and cognitive changes too. Like you'll hear a lot about like brain fog and memory changes with COVID, and that's definitely like a new sort of area of research, and something that we need to be working really hard on in the medical community about how to support people through, because it can be really real and lead to a lot of disability. Oh yeah, one thing to be aware of with COVID, especially with kiddos. So kids, fortunately, we don't really know why this is, but kids tend to have much more mild symptoms from COVID than adults do, which is great. But for kids or adults, even so, like you might notice like a first few days of like maybe kind of mild symptoms, and you think that you're kind of turning a corner, but it can happen that like after about a week of having COVID, you can take a turn for the worse. And that is like one of the times that people end up sometimes having to be hospitalized or go to the emergency room, because after that like initial period of time, then suddenly the shortness of breath comes up a little bit stronger than it had before. And so just something to be aware of with COVID. But again, fortunately, kids tend to have a much more mild form of the illness than adults do. And then RSV, I'm sure that people have been hearing a lot about RSV, because for the reasons that we were talking about earlier, this virus has really hit our communities much harder this year than we've been used to in the last several years. And again, that's probably because people's immune systems weren't as used to the exposures, and they're not as strong as they were a couple of years ago before the pandemic, because we've all been so isolated. RSV, while COVID can be more mild in kiddos, RSV is actually a lot more serious, especially in like really young infants and young kids. So I'm curious, has anybody who's on like had experiences this season with RSV in their kiddos or in their communities? Does anyone want to share? I know there's been a lot of just a lot of it out there. Someone's 2-year-old had it, it looks like, yeah.
Yeah.
And I'm also seeing this chat about the question in the chat just about children getting long haul COVID. I've heard less about that. I've not heard too much about kids getting long COVID symptoms. But it's kind of a ongoing area of research, I think. Well, yeah, I hope that anyone who's had a kiddo with RSV this year has been like fortunate and that their symptoms haven't been very, very serious. In kids and young children, the reason that it can be so serious is that usually with most of these viruses, we talk about like upper respiratory symptoms, meaning like runny nose, sore throat, like things that are kind of just like up above the lungs, basically. But in kids, their sort of lung development is like so new and like less advanced, and just like less, their little bronchioles and like little lung channels are so small that RSV can settle in their lungs actually and cause more significant lower respiratory symptoms, meaning like really significant pneumonia, wheezing, and apnea. That word here means just like difficulty breathing and like episodes where they cannot breathe. So it can be pretty scary. And we'll talk in a couple of slides just about like warning signs to look out for in your kiddos and like reasons to really be kind of like watching their breathing, and maybe call your doctor or take them to the emergency room if you're noticing that the way that they're breathing actually looks concerning. Older kids and adults, RSV tends to look more like the common cold. So just kind of like a cough, runny nose, like maybe a little bit of a headache and just kind of congestion. But if they get it more than once, then it can also lead to some of those like lower respiratory tract symptoms. Just curious, guys, when I am opening the chat here, can you see it when I'm sharing my screen? Or I don't know. Okay.
We just see your current slide each time.
Okay,
So,
oh,
yes.
great. Okay, so I can be looking at the chat. Wonderful. Okay, I'm going to advance my slide. And I think this is Claire, right?
Yeah, so we already talked about a lot of these things and how to prevent serious illness and how to kind of avoid keeping your kiddos out of the emergency room. This was taken from the Washington State Medical Association. Actually, one of our faculty like helped write it, and it's kind of like kind of the 5 like main things that there's good data behind on how to keep kids from getting severe illness, which sometimes is the only thing that we can try to prevent, because sometimes it's just unavoidable if your kids are going to daycare, seeing lots of people, like they're going to get sick. As we know, kids get sick a lot. So the first thing is vaccinations. So everyone who's 6 months and older, like we recommend getting vaccinated for flu and COVID. And then if kiddos are 5 years and older, had their last COVID shot more than 2 months ago, they can get a booster. There was a study last year now, in 2022, that showed that flu vaccines reduce a child's risk of severe life-threatening flu by 75%. So there's really good data that it can help prevent like the serious illness. And that's another thing we were talking about earlier, like if you're breastfeeding or have a young kiddo, it can help keep others around them from getting that severe illness. So washing your hands frequently is another thing. I think kind of you should always wash your hands. I think we realize that like COVID is more of like a respiratory illness, but especially RSV is like very transmissible through like touching things and germs. So it's always still good to be cleaning off those surfaces that you use a lot in your house, washing your hands, and then making sure to like teach kids and adults to cough and sneeze into their elbow, and then wear masks if you can. And then staying home from school if your kid is sick. Obviously, I know that's really hard for a lot of people. Childcare is really expensive in this country, and you have to keep living life as you need to. But if you have that ability to keep your kid home from school, especially if they have a fever or have had a fever in the last 24 hours, that can be really helpful. And that can also be guidance for you. Like if your kid is going to someone else's house, you can ask about like whether their kids have a fever and know a little bit more about like when it might be safe to have them get together. And then if you are worried about your kid, you can always call your doctor and kind of ask, like, there's almost always an after hours line that you can call, and you can ask about like, should I be worried? These are the symptoms that my kid is having, and they can kind of give you guidance and help get you into an appointment sooner if that's what you need, so that you don't have to like spend all that time waiting in the emergency room and be exposed to other people who are sick. And then there's a medicine that some kids who were born really early are eligible for that helps prevent against severe RSV. Also, some kids are eligible if they have certain like neurologic or cardiac problems. So if you know of a kid who's like extra immunocompromised, or you don't know if yours is, you can ask your doctor if they're eligible for that medicine.
All right. So I think I come across this question a lot in my own clinic, and patients who come in and either for themselves or for their kids are coming in with symptoms of cough and maybe a runny nose, and they're feeling not great. And I'll ask them, tell me all your symptoms. When did your symptoms start? What have you been doing that's been helpful? And a lot of the time, we'll wrap up the visit by me just reinforcing some of the things that we'll go through later on in the slide about what we would call like supportive care. So how to treat their symptoms, how to help them feel better, and how to help them get through this illness. And I have patients ask all the time, well, aren't you going to give me some antibiotics? And I bet some folks on here already know the answer. So does anyone know why doctors often don't give antibiotics for something like what's likely a cold or other kind of viral illness?
Because those are viruses, and antibiotics don't treat viruses.
Exactly. Yeah, 100%. And I think it's, I imagine many people on this call are very informed and know that, but so many people don't, and it's not obvious. And so I think a lot of the role in a primary care clinic is just sort of working to help explain that, so that patients don't feel like we're dismissing their symptoms, because what they're feeling is real, but explaining exactly why it is we don't want to give antibiotics if they're not necessary. And the vast majority of winter colds, and that includes like respiratory illnesses, sinus infections, ear infections too. Most of them are caused by viruses. And so like you said, we don't give antibiotics for viruses because it won't help. And that said, sometimes people then do end up progressing. So especially for sinus infections, I think of this a lot. Most sinus infections start out as a viral illness. And what can happen if symptoms persist for over 10 to even 14 days, what can happen is you've got all of that congestion and blockage of and all the mucus is sort of sitting in your sinuses, and that stuff is exactly the kind of stuff that like all of that mucus, bacteria love that. And so what can happen is a superimposed bacterial infection on top of that viral infection. And so in those cases, when symptoms are persisting beyond that 10 to 14 day mark, and especially if people are starting to get worse or having any like fever symptoms, then sometimes we will say, actually, maybe at this point it is a bacterial infection, and so we'll treat you now. But even so, all of these viral illnesses will likely get better without any antibiotics, and antibiotics won't help them. But some of the time, the bacterial infection, like bacterial ear infections, do sometimes clear up on their own. So particularly more with adults than with small children. Sometimes we still take a wait and see approach to see if people will clear something on their own. And part of that is because we do, and the evidence shows that a lot of times people will get better without antibiotics. And we also want to make sure we're being good stewards of antibiotics and not contributing to bacterial resistance. And then this is another question that I think I get a lot. Patients will come in both for themselves as adults and for their kids, and they'll say, no, my kid's mucus, all their snot is really green, and that's a sign of bacterial infection. Does anyone have thoughts on whether or not that's true, or maybe partly true, or not at all true?
I think partly true, what I would go with. Mhm.
Yeah. And we're seeing some not always, and someone says yes, that's what they've been told, and and that color can indicate how old the snot is. Yeah, I think that's interesting, and maybe that's partly what sort of that misconception is that sometimes I think, especially if people are staying sick beyond that 10 to 14 day mark, I feel like at that point your snot is like kind of green and funky. But it's not always true. So I think most of you kind of had that impression. So viral infections can also cause nasal mucus to turn yellow or green. So it's the color of your snot isn't necessarily an indication of what is causing your illness. Although I would say if your snot is yellow or green, then it probably you're probably not healthy. So there's something going on. And that even if you do have really funky looking yellow and green mucus, that it can still be a viral illness. And so that's not necessarily an indication that it's something bacterial, and that just to reinforce that infection can really persist for up to a week and a little longer, but they'll generally start to clear up and you'll start to turn a corner by that 7 to 10 day mark.
Sorry, doctor, could you repeat that for me? Like the reason why the mucus is green, or what that, I guess we know what that means, but the green color specifically. Yeah.
Why does mucus turn green? So to be honest, I actually don't know what makes it green. I think we see in the chat someone mentioning that indicates how old the snot is. I don't know that to be not true, and I can't say that I know that's exactly the cause. But I can say that green snot doesn't necessarily mean it's a bacterial infection.
And I noticed sometimes, like at the very start, onset of an illness, you have like your snot is greener than like a few days down the road. So, yeah.
And so it could be your body produces a lot of different things and cytokines and different products to fight off an illness. And so it could be just a buildup of all of those cell parts.
That is such a good question, and I Googled it, and
oh, thank you.
And the University of Pennsylvania, which I don't know, I feel like they know what they're talking about. It says, why does the color of your snot say about your health? It says the yellow color comes from dead white blood cells, which are the cells that our body uses to fight infection, which can turn green if there are a lot of them, and other debris like dirt and things that your snot is there to catch. So it's true that probably if your snot's sitting around for a long time, it's catching on more dirt and debris and can turn greener.
Awesome. Thank you for that real time.
Yes, thank you.
Real time research.
I think Jasmine, I believe, sorry if I had her hand up. I think she's on the bottom. I got to scroll down. Yes, Jasmine.
I'm actually going to say that because that's what my kid's pediatrician told me about how it catches the debris, and that's why it's sitting there longer. It changes the color.
I love it. Oh, and that was your comment too about how old the snot is. And so that also kind of makes sense.
Thank you.
Awesome. Thank you. And then just to wrap up this slide, just emphasizing that antibiotics can sometimes be indicated for bacterial sinusitis, or if we're concerned about a superimposed bacterial respiratory infection. And again, that's just if symptoms are lasting beyond 10 to 14 days. And then really, I think this second bullet point in the second column is just this point about the fever. So if your kid is having a fever higher than 102 for 3 to 4 days, then that would be definitely cause to want to give your doctor a call and see whether or not your kid needs to be evaluated in person, and probably they want to be checked in on. And then facial pain with fever. And really the key point here is if they're having a high fever persisting beyond a couple days, then that's, we'll talk about warning signs down lower, but that's something to look out for.
Cool. So what do we do for our sick kids? It is so hard. It's so hard to treat these kiddos who are so sick and just look so miserable. And I am so excited to hear first, before we kind of start sharing our information, I'm excited to hear from you guys just about like what your favorite like remedies are, or like ways to kind of symptomatically help your kids or yourself feel better when you have a viral illness. What are the things that you go to? Like your doctor said, okay, everything's probably fine. They just got to ride it out. Just do supportive care. What does that mean to you guys?
Gatorade, a lot of Gatorade. They love Gatorade and honey. Yeah, honey's good
Cool.
too. Mhm. Popsicles. Yep, sorry.
Love it. Someone in the chat is saying, ooh, tea with garlic. I don't know that. Jasmine, I don't know that second word. Mullion honey? Is that
Honey, of course, definitely a
It's
good
mullein
honey.
honey.
Very
Mullein
good
honey.
Yeah, very good mullein honey, yeah. Honey
Oh.
and a chicken broth,
Mhm.
chicken soup, definitely.
Love it. Ooh, Kime says miso soup. Yeah. Cool. I've never heard of mullein honey. I'm gonna look it up. And then Taylor says elderberry, black seed oil again, manuka honey, smoothies only, no starch. I'd love to hear, Taylor, what your thoughts are there about no starch. I don't disagree. I'm just curious what your what your thought process is there. I've never heard of that specifically. No dairy.
Yeah, well, we're a pretty much vegan family, and so like no dairies, like I always recommend to my clients, just because it just creates so much mucus. But also like rice and bread and all those things, they are sugary, and that just keeps the sickness around longer.
Yeah.
So I just try to make them eat fruit and veggies until anything surpasses.
Yeah, that sounds good. Yeah, I know dairy. I don't know if there's like quote unquote evidence for this, but like dairy definitely seems to be kind of like thickening and like further congesting. Like it kind of like does the opposite of like the things we want to do, which is like thin all of the secretions and make them easier to clear. So yeah, I think
it actually increases phlegm.
Right. So I think, yeah, it's that is great. And then, yeah, the virus feeds on sugar and wheat. So like maybe trying to avoid kind of some of those like simple carbohydrates, like the starches that Taylor brought up, humidifiers, VapoRub, olive oil, and garlic. Yeah, garlic has like such good like immune properties for sure. Prayer, yeah, totally. Cool. Thanks, you guys. Those are all great. Just to kind of add on to some of those amazing remedies, this is kind of a busy slide, but like number one point, which like several of you brought up, and like the number one thing that your doctor is probably going to tell you is hydration. So kiddos, like it's okay if they don't eat a ton of food for a couple of days. Like they don't need to be eating 3 meals a day when they're sick. Like it's fine. But the thing that we're worried about is their hydration status and making sure they don't get dehydrated. And so like that is the thing that we want to really focus on. And however your kids are going to stay hydrated, like usually we say like, oh, like try not to drink too much juice because like it's too sugary, it'll give you diabetes, whatever. But like give them juice when they're sick, like give them whatever kind of like liquid they're gonna drink, whether it's Gatorade, broth, popsicles are a really good way if they don't want to like sip out of their cup or a bottle, just like freeze some juice or some like Pedialyte like in the freezer and give them a little popsicle to suck on. Ice chips, just really make sure that they're getting some hydration into their body. People are keeping it up with the chat. I love it. And then rest. Yeah, like rest, like our bodies need time to fight off this virus that they've got. And like they can't do that if we're running around outside in the cold and if we're like trying to stay active with all of our normal activities, like we're going to recover more quickly if we're given time to just rest and sleep. And I think we say this on a different slide, but like it's normal and okay for your kid to be more tired when they're sick. Like that's part of what's allowing their bodies to like get stronger and to fight off the virus that they're trying to kill. A little bit on medications here that are safe to give. just because being sick can be so uncomfortable. Like you can get those body aches and you're just miserable with like a sore throat, headache. These are the doses of Tylenol and ibuprofen that are safe to give for kids. And so I know it's like a little bit, like you might not know exactly how many kilograms your kid is, but hopefully your doctor is able to also give some guidance with that. Tylenol, you can usually dose like up to every 4 to 6 hours, and ibuprofen is usually every 6 hours. And so you can kind of like alternate between the two so that like really around the clock, your kiddo is able to get some of these medicines that are going to help them feel better. One important thing to highlight is that, so aspirin is also available over the counter, and sometimes adults take aspirin for pain and discomfort, but it's not safe to give to kids. It can lead to some pretty serious health conditions. And so you want to focus on Tylenol, which is acetaminophen, or ibuprofen, which is in a bunch of brand names like Motrin or Aleve and Advil.
Can I say something about that?
Yes.
I was confused for a long time because everyone says a baby aspirin, which can be super confusing. But baby aspirin is not for kids. It just means that it's a small dose for an adult. So I just wanted to explain that because I learned that not too long ago.
That's such a good point. And then, yeah, just some other things that can be, well, there's just more on the next slide, but other things that can be helpful. This is like, especially if you have an infant who's maybe not able to like blow their nose themselves to clear out those secretions. You can get a little bulb. A lot of you probably have this in the home, but like a little like plastic bulb that's like a suction, and just like, squeeze it so that there's no air in it, and then let go, and it'll like, and put it in your kiddo's nose, and it'll kind of just suck out some of that snot and help them get a little bit more comfortable. You can ask your doctor or just go to the pharmacy and get some like topical saline. So saline is just like salt solution basically. And that can be really soothing. And also like in kiddos like nasal passages, and help thin their mucus to make it easier to suction out is one of the things that you can try. There are a ton of medicines at the pharmacy that are like decongestant, like, mucus thinning, like mucolytic, like any like things that say that their purpose is to like thin mucus and make you less congested. But unfortunately, they're not safe for kids under 12. And so really, in terms of like medications, I think stop me if you guys think of things that kind of like are exceptions to this rule, but really the only ones that are safe for kiddos under 12 are Tylenol and ibuprofen, and like other things like cough syrup and decongestants. One, there's not evidence that they're helpful for kids, and two, there's not good safety data, and so they're just a little bit too strong for kiddos. Questions on this slide at all, or things that people want to add in before we move on? I can't see the chat right now for some reason.
Doctor, why was it that you said do not give aspirin? I didn't get the reason for that one.
Yeah. So there is a condition called, and Kime and Claire, you might know more about this than I do, but there's a condition called Ray's syndrome, which is a like really dangerous medical condition that leads to like liver failure, and also like can progress to some like really, what did you say, Claire, or no?
Oh, it's pointing to like my head.
Okay, yeah. It can be fatal for kids. I don't have a super good explanation for like why aspirin is so much more dangerous in kids than it is for adults. Beyond just that their like ability to metabolize it, like their liver and kidney isn't as like developed and can't process the medication quite as efficiently as an adult's like liver and kidney can. And so aspirin
Could it have something to do with the fact that it's a blood thinner as well? And
it's a good question.
Could that be the reason? Because I know like babies are not, born with that factor. And so, it has to be colonized in their gut, the vitamin can, and so on. Could that be why it's not a good idea? Because I know even for adults, aspirin is not to be taken for, you know what I mean? Like
Totally.
a Tylenol for pain management. Yeah.
Totally. Yeah, that's a good question. I don't think that the blood thinning is specifically like related to Reyes syndrome. You can look up Reyes syndrome, REYES. But that also that could be part of it could be related. I think that's a good point. And yeah, honestly, we should say like even adults, like aspirin shouldn't be given for colds and viral illnesses, because aspirin, there's so many medicines that are available over the counter that like actually aren't even that safe for adults to take. Yeah, aspirin's a blood thinner and can lead to bleeding risk, even for adults. So yeah, really you should just be taking aspirin if your doctor has prescribed it.
But yeah, I will just say I also don't know what it is about aspirin in kids that make it have that risk. I know adults, I think at any age, there is a small risk of Reyes syndrome, but it's just primarily a children's disease. And I also don't know exactly what changes from childhood into adulthood that makes adults less at risk, because certainly we do prescribe aspirin to adults. And I haven't ever heard of an adult getting Reyes syndrome, but I think it can happen.
So there's a good question in the chat about why we say to switch between Tylenol and ibuprofen. I can take a stab at it, and then if you guys have stuff to add, feel free to pop in. I think there's really good evidence, at least for symptomatic management, that using both of those medicines together, at least for pain, is equally, if not more effective than something like an opioid medication. So it's really good at treating symptoms. And another reason I think is that you're not giving like too much of one medicine. So you can't like build up, like you're not giving like too much Tylenol and maybe like causing damage to the liver. It's like a little safer. Does that sound?
Yeah, totally. It's kind of just like they have different like mechanisms of action. Like they're totally different medications. So it's, first of all, safe to give both of them together. And it's not like you're giving a double dose of something. They're very different. And so you're kind of just like hitting like the inflammatory processes that are causing discomfort from two different pathways. So it's like more effective, like Dr. Miller was saying.
Agreed.
Other just like sort of symptom specific supportive care things. So the reason that we say to do like warm liquids like broth or like tea, if your kid is going to be willing to drink tea, or even just like hot water, is because that helps thin secretions and can be like make things easier to clear, and also can just be much more soothing for the respiratory tract. Humidified air, same thing. Humidified air can be like really, really soothing. And even if you don't have a humidifier like that you would buy at the pharmacy or the store or whatever, I'll tell people to just like go into the take their kid into the bathroom and just like run a hot shower for a while and kind of like fill the bathroom with steam and just kind of like breathe in that soothing humidified air, or boil a pot of water on the stove and kind of just like breathe in the hot steam if you don't want to like go out and buy a humidifier. Honey is amazingly soothing, but like big important point with honey is that it shouldn't be given to anybody. Ooh, fresh eucalyptus in the shower. That sounds amazing. Oh, I love it. Honey should only be given to kids who are over 1 year old. The reason for that is because there is like a small risk of a disease called botulism, which is a bacteria that grows in honey that older kids can fight off really easily, and adults can too, but kids who are younger than one year don't have the immune strength to be able to fight off that bacteria if it's present in honey, and it can lead to some pretty serious like neurologic defects. So don't give your kiddo honey if they're less than 12 months old. Lozenges are like cough drops, and we just say to avoid them in kids younger than 6 just because they're like a choking hazard. And then again, just like, unfortunately, not recommended to give cough syrup, like codeine cough syrups or dextromethorphan to anybody who is younger than age 12. And then for sore throat, yeah, again, sipping on warm liquids, like sucking on popsicles or ice, lozenges, again, if they're older than 6. And then salt water can be like, especially like warm salt water, in order just to just kind of like tilt your throat back and like gargle for a few minutes to kind of like help soothe any irritation in your throat can be really helpful. Anything else you guys want to add to this supportive care slide, or any other thoughts? I'm going to do eucalyptus in the shower next time I take it. I'm just going to do that when I'm not sick, because that sounds amazing.
I think I am a big supporter of gargling salt water. I feel like whenever I think I might be getting a sore throat, I'll do that before I go to bed for a few nights. And I think it helps. And then sometimes, and I love your ideas of like different types of steam baths. Sometimes what I'll tell people to do is, if their kids are old enough to sort of be able to participate in this, but like you could fill a bowl with hot water and then put it sort of a towel over your head and make your own like little mini private steam bath just for your head. If it's like hard, I feel like where I used to live, it was hard to like have a real steam shower situation. And so sometimes it's hard in the bathroom, but and then the other thing that I'll recommend for patients, and again, I think this is hard with little kids, but sometimes if your kids are a little bit like school age, but doing the nasal rinses, and you can do that with little kids. They just, I think it's not pleasant, but it does relieve a lot of pressure from that mucus buildup in your sinuses. So does give you a lot of relief if you can get your kids to do it.
Before you go to the next slide,
Mhm.
so the next slide is about like warning signs and reasons that you would want to call your doctor bringing your kids into the emergency room. I'm curious if anyone has memorized the questions that they get asked when they call the doctor. Like, what do we want to know, and what is kind of a warning sign that you think of before you get more worried about your kid?
Are they eating and drinking, or when is the last time they ate or drank?
Yeah. Anything else?
Fever, if they have fever, if they've been throwing up,
Yeah, how long have-
lethargic.
Yeah.
Lethargic.
Yeah, their skin. Yeah, so we can go to the next slide. Those are all. Oh, go ahead. I thought.
Sorry, no, go ahead. Sorry about that.
Oh, it's okay.
I'll just add, how long have they been sick?
Yeah, how long they've been sick for, definitely. So it's always okay to bring your kid to the doctor because they're sick. I think like what I'm trying to get at with this slide is more like when you would want to maybe not wait for that appointment and maybe call and think about going to the emergency room. Things that we would tell you to like, you need to be seen right away for. So we talked about like hydration. That is why we try to hydrate with supportive care. A big reason that kids come into the hospital when they are throwing up, it's not necessarily like dangerous that they're throwing up, but it's because they can't keep down fluids. So if they're not able to keep down fluids and are getting dehydrated, that's something that you should call about. If they're having difficulty breathing, so one thing that we like try to ask about, but I think is kind of hard to ask about when you don't know what it means, is like, are they using, I will always look when kids come in, are they using their muscles to breathe? Does it look like they're working hard to breathe? And I'm not that tech savvy, but I'm going to share a link if you want to watch it. It's like it's sad, but it's a kid who has a bad cold, and it's a picture of what it looks like when they're using their muscles to breathe. They get some nasal flaring, and then might go in. If you look at their tummy, they might be like sucking in their ab muscles. That's something that's very worrisome. And that's how we know, sometimes like parents are worried, oh, it's hard for my kid to breathe. But there's a difference between them being congested and it being like uncomfortable and it actually them working with their muscles to breathe. And then another thing is like if they're drooling a lot, if they are having a change in their mental status. So like you said, like being lethargic. So it's okay if kid is tired and sleeping a lot, but if you're worried that like it's becoming really extreme, or they're acting differently, or like really not keep their eyes open, even though they're getting enough sleep, that would be something to call about. And then we'll talk a little bit more about fever on the next slide. But does anyone have any questions about that slide or anything they want to add?
So these will be like dangerous signs, not just you take your kids to the hospital and they ask you, you know what I mean? Like your kid is sick and they'll, yeah, okay. So,
Yeah.
okay, so these are the dangerous signs, not, okay. This is,
Right.
if your child is doing this, you need to get them in.
Yeah, and I think I just wanted you guys to be empowered like with that information, because if these are the questions that we ask when we get a call at night on the after hours line. So this is what we're gonna ask you. So I just these are signs that you can look out for, and that would be a reason, if you haven't already, to call an after hours line, or if you can't get a hold of anyone, to go to the emergency room. If none of this is there, then usually your kid is probably okay, and you can wait to make an appointment, or call and try to get one scheduled.
And again, I think just emphasizing like the hydration piece, like we'll definitely, like doctors will always ask like, well, like, are they eating and drinking okay? And again, it's normal for them to be eating less. Like that's okay and not a reason to be worried. But if they're not able to keep themselves hydrated, then that could be a reason to go to the emergency room. And one of the ways that we like clinically look for signs of dehydration is if they usually have like 4 or 5 wet diapers a day, and today they only had 1, like that's concerning. It means that they're not putting out enough liquid and therefore not getting enough in. And then you can look too, like, you know, like I'm sure all of us have had experiences like where like our lips get chapped and like our mouth just feels really, really dry. Like if you look at your kid and like his or her like just mucous membranes, like mouth looks really dry and cracked lips, or sometimes I'm going to try to show this just because I did it in clinic with a patient the other day. You can look at your kid's skin to look for signs of dehydration too. So I'm going to show you on my hand, like see how I'm like pinching like the top of my hand skin here. And when I let go, it goes right down because I'm not dehydrated. I've been drinking water all day. It goes right down. But if I was a sick kid and I was dehydrated and I lift it, and this happens with like older adults too. Like if you lift your skin up like this, and if I let go and it stays up like that, like it stays tented, that's a sign of dehydration. Because it's like your skin isn't like moist and hydrated enough to be able to just like bounce back really easily. So that's kind of getting into the weeds a little bit, but that's like one of the things that doctors like look at in the clinic or in the clinic basically to decide if we need to send you to the emergency room.
Thanks.
I just want to add, for speaking of dehydration for babies, sometimes it's their front nail, that little soft spot
Yes.
that gets dent. Yeah, if babies are dehydrated, so that actually, there's a dent in that. So yeah, that's some of the things I talk to my clients about, dehydration in baby, beside the output, the pooping and peeing.
Totally. Thank you for adding that. Was that FISA? I didn't see, but thank you to whoever added that.
Oh yeah, that's me.
Cool. Thanks.
Yeah, we definitely look at that too. It can be hard sometimes to assess, even for us, like whether a kid's fontanelle feels differently, but it's definitely like one of the things that we use. So the next slide is about fever. This is something I feel excited to share.
Sorry, there's a question. Sorry, there's someone's hand raised. Yeah. Yes, Naima.
Hi, yes, I have a question. I have a newborn baby. So, for example, the newborn baby, I only breastfeed. Sometimes I give them a little bit formula, but 90% breastfeed. So, in case the baby's sick, and they're not getting enough milk, what am I gonna do? Since I can give them water or things like that, or should I give it?
Yeah, that is super tough. Yeah, because before a baby is 6 months, it's really recommended that you're just giving them like breast milk or formula. And I would say like if you feel like if like your baby is not getting in enough breast milk or if like you want to, you could first try supplementing with formula, like you mentioned that you have maybe done. And if it's still not like working, like if baby's still not taking anything in, then I would say that it is a reason to be seen by a provider. Because if baby's not able to get in enough fluid through like their primary means of nutrition, which is milk or formula, then they need to be seen. I wish there was a better answer.
Yeah, same. So this slide is about fever. So fever is the body's response to an illness. It's when your brain kind of upregulates your temperature in your body, and it causes a lot of things to happen. But one thing it does is it stimulates your immune system. So it's a signal to all the immune cells in your body to start working harder. It makes it a bad environment for germs to grow, because a lot of bacteria and viruses like higher temperatures. And then other things besides illness that can cause fever are like especially younger kids that can't regulate their temperature, like they can get a fever just from like having a lot of clothes on and it being like hotter inside. And then it's also can be very normal to get a fever, like a mild fever in the day or two after getting a vaccination, because again, it's your body's like immune response learning how to handle that illness. The fever itself is almost always not dangerous. It's honestly sometimes a good sign because it means your body is doing its job. But it can be really uncomfortable. We've all had fevers. It can contribute to body aches and just feeling like generally unwell. And so I just like to tell people to remember that when you're giving Tylenol, like you don't need to do that to treat a fever. There's no reason that you need to bring the fever down unless it's super high, and we can talk about that. It's more just like whether your kid is uncomfortable, it can help with symptoms. So there are times that it is important to call right away. So if your kid is less than 3 months, we really want to know about fevers, and almost always, especially if the kiddo is less a month or less, we will always tell you to bring your kid into the hospital if they have a fever. And we define fever as over 100.4 degrees. So if your fever is higher than 102.2, that's pretty high. So you should also give your doctor a call, and that's in a kid of any age. And then there are special times when like maybe certain kids may be immunosuppressed or have other things going on. Maybe they have cancer, maybe they have a respiratory condition, and it might be a little bit more serious if they have a fever. So you can ask your doctor if that applies to your kid. But generally, if a kid has a fever, we just want to make sure that they're comfortable and keep doing all those like supportive care measures so that the body can do its job. And then again, if any of those warning signs we talked about come up, then you would want to call your doctor.
Cool. That I think is all the content that we had like specifically to share. But just pointing out healthychildren.org is a really good resource if you want to ever go to that website for some information. Some like pediatrician specialists run that. And then we're also always going to the CDC website just for specific information about all of the viruses that we discussed. It's been really fun to talk to everyone. And I learned so much from all of you also just about some of the other kind of like herbal and like dietary like things that we can be adding to our advice to people. We're around if anyone has any other questions or things they want to share, ideas.
Same. I learned so much today as well, doctors. So I'm just like taking all these mental notes and writing things down that I can be doing, adding to my arsenal of, you know, helping my kids get better. I wanted to ask, and maybe you mentioned this before, but when doctors are kind of looking at this triple-demic, how are they diagnosing that? And how do they know, like, if you have one thing or two things or all of them? Just wondering about that.
That's such a good question. Is it okay with you guys if I take it and then add? So there's obviously home COVID tests. Like if you call us and like you say, hey, I took a home COVID test and it's positive, like we basically trust those tests and don't need to repeat it in the clinic. I really wish there was a home flu or RSV test also. I think that would be so cool for people. That doesn't exist yet, as far as I know. And so in the clinic, typically, at least in the clinic system that we work at, I'm pretty routinely like swabbing kids for, we have like one swab that we use in the nose that tests for flu, COVID, and RSV, like all in one. And so we like do that swab and send it off to the lab. It usually comes back in like 24 to 48 hours. So it's not instant. And that's how we kind of know what we're working with. I'll say also, it doesn't really matter that much. We don't, like, if I know that I'm treating the flu versus treating RSV, my recommendations aren't really going to change that much. Like I'm going to recommend the same supportive care no matter what. It might matter like a little bit more in terms of like isolation and like wanting to keep other people in the family and community safe. Like just because we know the flu and COVID in particular can be so dangerous for older adults, especially. So that's kind of the reason that I'm swabbing people, is mostly just for like community safety. But it doesn't really matter that much in terms of like recommendations, because our reasons to go to the emergency room are going to be the same. Does that answer your question?
Yes. Thank you. Yeah, it does.
I think the reality is a lot of times we don't know, especially with these three viruses. And sometimes our best guess will be based on the numbers in the community. So if RSV is, peaking and we're seeing tons of kids in the hospital with RSV, we're more likely to think it's RSV. But a lot of times we just don't know.
I agree. And I think also when we're seeing patients in the clinic, we don't necessarily have easy access or quick access to a lot of the panels, the respiratory panels that we'll test people for in the hospital. So if someone is sick enough to need to be admitted to the hospital, oftentimes we'll run a respiratory panel and it'll look at a whole bunch of viruses, like 12 to 20 or something different viruses. And again, that doesn't necessarily tell us much in terms of changing how we're going to treat them. But I think it's just information then for our like public health departments to know what viruses are being circulated that season and at that point in time. But in the clinic, it's not easy to run those panels. And it doesn't really change our management. But I think flu, RSV, and COVID are sort of the big ones. And so sometimes we'll do those in clinic.
Awesome. So I have a question not related to what we're talking about today, but I've heard that there's a measles outbreak again. Are you all seeing, like, because there are like 3, I just got an email yesterday from King County Public Health personnel that Ohio, I think Minnesota, and I'm forgetting on the other state, there is, and there seems to be multiple cases here too. Are you all seeing any of that?
Gosh,
Measles,
not yet. Go ahead, Claire.
Okay.
not yet. It's really scary. And as people are having questions about vaccines, we're seeing like little outbreaks every year. I know there was a case, I think it was last year, that there was a case somewhere in like Southern Washington, or a couple of cases in Southern Washington, or maybe Oregon. But I'm not aware of any right now. And it's not like, hopefully it never becomes prevalent enough that like we'll be seeing lots of kids with it.
Yeah.
Oof, yeah.
Yeah, I just got it yesterday. Yeah, So, and there's some report from CDC and all that stuff in there too. So, yeah, it's,
That's a
I just hope that's not the case.
I hope that is not, yeah, I hope it's not coming, or I hope we're not seeing that in King County anytime soon. I also haven't seen or heard any guidance in my clinic about that, or any guidance from like this bigger Swedish entity. But I did hear about that case. I think it was sometime like maybe mid or early December about the case. Or maybe there were a couple cases in central Ohio, but I haven't yet heard of any in Washington, and that I might be wrong, but.
There is a question about things that you can do. It says, are there any things or preventative measures parents can take before winter season to help their kids not get sick or more sick? It's a really good question. The biggest things is vaccines. I like to get my shot in like late October, because then I can have my kind of immunity built up by the time winter season comes around. So it is a good idea to get your flu shot before the spikes happen. And then the things that you guys were talking about are really important to immunity. So eating nutritious foods, getting enough sleep so that you're not your immune system isn't down when you go into that time. And I wanted to mention one question I get a lot in clinic is whether flu shots or different shots have like gelatin or pork products in them. And there are lots of different kinds of flu shots. The kinds that have gelatin in them are the flu mist vaccine, which goes in your nose. And then one of the like quadrivalent shots, which is one that this year they've been recommending for older folks because it covers more strains. But there isn't any in the other ones, and different pharmacies and different clinics carry different ones. So that's something that you should be empowered to ask about if that is your worry. I feel like it's my responsibility to like know that information and share that with patients. So I encourage you to ask if there are any hesitations or questions about vaccines so that you feel safe taking them.
Just in that vein, doctor, also I think making sure like parents have caregivers have like the medications they need, like a Tylenol or ibuprofen, stock up on those or whatever medications you think you'll need. And if like one of my kids has mild asthma, so I always make sure like, his inhaler is ready or whatever other medications that he needs, so that, like the recent shortage we had with that, just to be ready. And also knowing where the closest emergency department is, taking a snapshot of your kids' medications or immunization record, just being prepared, because you never know what can happen. So,
Thank you. I meant to talk about that and I totally forgot. That's such a good point. Making sure that you have all of your asthma medications and that you're taking them so that your breathing is okay going into that season. That's so smart.
those were all of my questions. I feel like you answered all of my questions today. So I'm so excited for the session. Does anyone else have any last minute comments or questions for our doctors? Yeah.
I also
And
just
for
wanted
anyone,
to say,
oh, go ahead. Yep, sorry.
Oh, I just wanted to say also thank you to all the participants for sharing their own knowledge. I feel like that's one of my favorite things. I always leave these sessions feeling like renewed energy in this work, just because I feel like I learn a lot and it's just good to be with you all.
Absolutely, Doctor. I absolutely agree. Yeah, thank you. And just for if anyone didn't get a chance, I dropped the stipend form again in the chat box. And for next time, doctors, I will communicate with you about what our topic will be for next time. But thank you so much. Sorry you can't see me, but at least you can hear me. Yeah. Note to self: test Zoom camera before presentation. Yes, for the future. Yeah. Yeah. Thank you guys so much. It's so good to see you.
Thank you all so much. It was really fun to be here.
Absolutely.
See you next time.
Thank you. Thank you, everyone. Bye, guys.
Bye.
Bye.